think our program offers some really cool features. As a smaller program, we have the ability to offer some flexibility that some larger programs really can't. So our fellows are able to tailor their educational experience, the didactic experience, the clinical experience to meet their educational needs.
One of my big loves is education and trying to figure out how do you learn best and making sure that what we're doing from a training perspective, from didactics perspective, and just life is working individually.
As fellows, you're going to get to build kind of your own practice. I thought that was a really good experience because then it helped me develop the type of style of a clinician that I wanted to be.
You get to be more immersed in what you're doing. You get opportunity to work with everybody in the system. And you have a program and a program director that is always looking out for that.
And so having access to, to PhD level kind of successful researchers as an endocrine fellow, just, directly connected to these people, I wouldn't have even known to ask if that was possible when I was applying for fellowship.
Children's hospitals are full of very nice people throughout the world, I think. But I think especially there's a special feel at Le Bonheur.
We're at a nice spot in that we're the only tertiary level comprehensive pediatric hospital in Memphis.
Le Bonheur is our freestanding children's hospital. It's fantastic, provides all the care that you would be used to, with the exception that the oncology and hematology are all at St. Jude.
It's a global superpower in terms of oncology research. And so that's only to the benefit of Le Bonheur as trainees. The pediatric fellows do clinic at St. Jude every week during our second year.
So the patient base in Memphis, as you know, it's right in that corner of the tri-state. So we really took care of patients in Tennessee, Eastern Arkansas, and Upper Mississippi.
But also the Boot Heel of Missouri, if you know your geography, that little Boot Heel, along with southwestern Kentucky. So we have patients coming from that whole area. And so even though Memphis isn't the biggest city, even in the southeast, our catchment area is huge.
Yeah, so Memphis is an exciting place to be as a relatively young person in training.
I think one of the things I felt coming from Dallas, I was a little worried that I would feel like Memphis didn't have the things that I wanted in terms of just restaurants and things to do. But there's not a lot that I've missed here in Memphis.
I've come to love Memphis. Obviously, I'm settled. I've been here for the last almost 5-6 years now. And I just got a new house here. So I'll be staying for a while.
If you're looking to live in a warm, welcoming southern place where the cost of living is such that as a fellow, you can live well, that it would be a good fit for someone like that.
The goal of Le Bonheur's Pediatric Endocrine Fellowship Program is to develop someone who is well-rounded.
We're not looking for people who know everything about pediatric endocrinology. That's what the fellowship training is for. But we're looking for well-trained pediatricians, so people who are finishing a residency who are enthusiastic about endocrine.
So I think an ideal candidate is really someone that is interested in really direct patient care and a really good learning experience, because that's what we got in Memphis.
My goal for fellows coming out of the program is so that they can go where they would like to go. Everybody needs a good place to train. Everybody needs a good place to live. Everybody needs a community. Everybody.